We last checked in with Andrea Scott via Zoom just before the Niagara Health Foundation's virtual Champagne and Slippers Gala back in February. Back then, she was the interim president and CEO of the foundation. Today, we can finally drop the word interim from her title. Andrea, welcome to The Source and congratulations.
Thanks for having me here.
Is it a big relief to have that word removed from your title?
You know, I don't know if relief is the word. I'm very proud to have the title. I'm proud to be leading such a great team at Niagara Health Foundation and working with the community to raise funds for Niagara Health. It's just something that it's a career that's really great to give back, and I'm really enjoying it.
Over the last 8 months, you've been in this position, and during that time, $9 million was raised during a difficult time.
Yeah, we had an outstanding year during the pandemic. We saw a lot of groups come together to give to the hospital. Like you said, raising over $9 million. We had to pivot a lot of events, right? Making them virtual, changing how we fundraised, going into the lottery market as most people saw. So we were very happy to do so well. And again, it's kudos to our team, right? We came together, changed what we needed to, and we see the results.
We're in an interesting time when, healthcare has really been front and center for 16 months. And whether we look at what was lacking in healthcare or how healthcare had to respond to a massive worldwide crisis, do you think this bodes well for fundraising for the Niagara Health Foundation as we move forward?
I think it does. I mean, having healthcare top of mind definitely helps with our fundraising efforts. I think it's always been a high priority for the residents of Niagara, but definitely the pandemic has shown those areas where we need more help and definitely helped us to raise those funds.
There was a successful campaign to purchase a new MRI machine. Can you talk a little bit about that?
Yes, so we were able to raise $2.8 million in less than 3 months for the installation of a new MRI machine at the St. Catharines site. We had previously raised $3.5 million for the actual equipment, so this is actually to do the installation. So this will be a third MRI at the St. Catharines site and will significantly improve wait times for the residents of Niagara.
Some major donors stepped up in that campaign.
Absolutely. So Tom Rankin was our community partner, and Tom reached out to the community asking for help for this project because it was near and dear to him. And we had many companies, many individuals step up and give large donations, all the way down to those smaller donations that come with a wonderful letter about why they're giving $25 or $50, and that was great to see. Barb Cornelius was the $1 million gift that we received, and Barb made that gift in memory of her late husband, and her seeing Tom's letter, just she realized what she wanted to do to keep memory of her husband, which was great. Yeah.
Not to sound crass, but how do you leverage these major donations when you move forward and, for instance, start your campaign to raise funds for the South Niagara Hospital?
Absolutely. So you see a lot of donors come forward for this MRI campaign, and we're building relationships with them, connections, and we'll be stewarding them. So we'll be showing them where that MRI is going in the hospital and all that Niagara Health is doing, and they become partners with us, right, and donors, and we can show them what their impact has made, right. So hopefully moving forward, they'll continue to look at Niagara Health Foundation as a charity they would like to give to.
That South Niagara Hospital that I just mentioned is going to take really a lot of precedence over the next 4 years. Mm-hmm. So what are some of your goals? Have you set goals for that yet, or are we still almost in the dark as far as what you actually have to raise?
Behind the scenes, we have set our goals. There is a regional share and a local share, and all those pieces have to kind of be ironed out and put together. The foundation will have a large part in raising dollars for that, as they did with the St. Catharines site. And we're doing a lot of work behind the scenes to ensure that we're ready when that campaign becomes public.
You mentioned the St. Catharines site, and just in the time that's lapsed between the St. Catharines site and now looking at the South Niagara site, so much can be learned, but so many costs have increased as well.
Absolutely. We're always, very mindful of our costs, and, it's something, myself being, a CPA and having that finance background, that we really work towards having that cost per dollar raised as low as we can.
That CPA background, can you tell me a little bit more about how that influences some of the decisions that you plan to make as president and CEO?
Absolutely. So, I'm very proud of the CPA designation. I worked in the hospitality industry for most of my career, and then came into fundraising 4 years ago with Niagara Health Foundation. And definitely the background, it helps in the aspects of running any business, right? So running the operations side and having that financial piece, top of mind and right there is definitely an asset for me. And going into a large campaign as we are, I hope it gives fundraisers and donors peace of mind, right, that their dollars are being kept well and spent accordingly.
Before we get to that large campaign, which is expected to last from 2022 to about 2026, am I correct?
Correct, yep.
We also have some events coming up. The Big Move Cancer Ride returns.
Yeah, our Big Move Cancer Ride, which will be virtual again this year, runs from September 3rd to September 19th. You can go to bigmovecancerride.com and register, join up for a team. You can see some routes on there to do your ride. So you'll be doing your ride on your own, but it was very successful last year. So we hope to raise, close to $400,000 with that event again.
And we're crossing our fingers that the Big Move Ride will actually be able to bring people together next year.
Correct. We're really hoping for, a year out, we will be back together. And if you've ever been to that event, the in-person part is just awesome. I mean, the emotion and everything you see about with those riders and completing that, it's just great to be a part of. So we hope to be back together, yeah.
You have another lottery going on as well?
We do. We have another 50-50 lottery starting July 26th, and that will run until the end of August. Our last lottery gave away $148,000 to the lucky winners, so we're hoping to do the same or better.
When we look at launching that campaign, when will that big announcement be timed for?
So it's hard to say right now. I'll say 8 to 10 months. There's a few things that have to come into play for the South Niagara site campaign to be announced, and we're working towards those. And we're eager to start the public campaign, and as soon as we can, we definitely will.